Hi, I'm Jack Cush. I'm here at ACR22 Philadelphia. We're on the exhibit floor in the Room Now booth, and I ran into Dr. Andrea Fava. I'm a big fan of his. Andrea's from Johns Hopkins. I met him 2 years ago when he had this plenary session talk on the value of CD16 as a biomarker in lupus, far surpassing all the things that we usually look at, like complements and proteinuria and whatnot. And he's been working in this area for quite some time. He's got a number of presentations here. Andrea, tell us about what you're presenting that you're excited about.
Yeah, we are showing the newest advancement on the urinary biomarkers. As well, we also other work from the Accelerating Medicines Partnership. So various things. So urinary biomarkers in relation to how can we use these non-invasive biomarkers of kidney inflammation to predict who's going to respond to treatment in lupus nephritis. And that's a kind of a revolution because lupus nephritis is an inflammatory condition. We treat with anti-inflammatory, which is immunosuppression, but then we look at response based on proteinuria, which is not a marker of inflammation. And so we're now using these biomarkers to say, oh, is the inflammation going down when we use these drugs? And then when it does, these are the patients that ultimately, after 1 or 2 years, are those who responded. And so this is a new way of looking at it. And then we also have other stuff from the AMP.
Right, so the proteinuria is really a marker of damage, right, mostly? And then the urinary biomarkers you're talking about, which one specifically?
Yeah, so proteinuria is the damage of the filter. It means the podocytes are damaged, and then whether there is inflammation or not, doesn't matter. You can have proteinuria. Now, the biomarkers, we confirmed the interleukin-16 as the biomarkers of nephritis activity, and we have found markers of macrophage activation, such as CD163 and CD206, and these are markers of the pro-resolving macrophages in the kidney. They are trying to heal and maybe causing fibrosis, but they are high at the time of active kidney lupus, and they go down after 2 or 3 months in patients who are effectively responding to immunosuppression.
Yeah, so I've seen your papers on this. It's really exciting. How practical do you think this is going to be? Obviously, you're just looking at urine, so that's going to be easily accessible, but what about getting IL-16 and CD163, about getting those done? You think those will be commercially available?
I think they will. I think that CD163 is the one that has the highest chance of becoming available because it has been proven as a biomarker in the blood and the urine in many other diseases. Wherever there is macrophage activation, I think macrophage activation syndrome is a good biomarker. Other like ANCA-associated vasculitis, IgA, nephropathy, they can have urinary CD163 as a biomarker, so that will come. And I think that these biomarkers are so become helpful not only to have a non-invasive diagnostic tool, but because you can measure them longitudinally, and that can be important. So in academic center in research, we are great at making these discoveries, and so now we are working to partner with industry and other partners who have the know-how to take this to the next level. So I'm hopeful that in the next few years, once we surpass the regulatory hurdles, and in the US, the payer and insurance hurdles, we'll get them available because they can truly change things. And if I can say one more thing, this is a great opportunity to change clinical trial endpoints.
Oh yeah.
And it can make the chance of success of a clinical trial much higher because the clinical trials are mostly with immunosuppressants, but they are measuring proteinuria as an outcome, and that can be messy. And the moment that we can validate these biomarkers as a better biomarker of long-term outcomes, and so if you stop me again next year, I'll show you that data.
Yeah, and what we didn't have time for here, but you have a body of literature on, is that these biomarkers, in your research, correlates with lupus activity.
Yes.
Correlates with histology on renal biopsy. All the things that we're really worried about. So that's why this is not something that's just a passing fancy. This is the future of lupus management.
I certainly hope so, and it can be so helpful for our patients, for clinicians, and for clinical trial development.
Yeah. Follow Dr. Fava at ACR and in the journals.